Hello, my name is Dr. Sean McCorkle, and I'm here at Summer Creek Animal Clinic. One of the common questions we get from pet owners is, why does my dog's breath smell so bad? And although there are many potential answers to that, by far the most common answer is gum disease or infection and inflammation in the gum tissues in the mouth. And that is caused by plaque and tartar buildup, just like in people. And if we don't brush our teeth every day, we end up with gum disease and bleeding gums. It's the same thing. It's infection and inflammation in the mouth. And it's very common in our pets because most of us don't brush our dog's teeth every day. And so the reason for that is the infection and inflammation in the mouth, and that is from bacteria buildup on the teeth. And so the other common question we get is, how can that harm my pet or my dog? And the way that that can affect your dog is, number one, that infection and inflammation is oftentimes very uncomfortable. And in more severe cases, it's very uncomfortable. And unfortunately, they will not show outward symptoms the vast majority of the time. All you will see is potentially some really subtle changes that are oftentimes, people associate that with aging, when in reality is they're painful and uncomfortable in their mouth. So pain is probably the most common thing we see as a side effect of this. However, because the infection and inflammation is in the mouth, that all the blood supply that's in the mouth can potentially spread that infection to elsewhere in the body. So there are potential outcomes there regarding kidney disease, liver disease, and even affecting the brain in some situations. And so those are the potential outcomes of the gum disease: pain and disease elsewhere in the body. And so what can we do? How can we address this, and how can we prevent it? If there is already active disease in your pet's mouth, which 85% of dogs by the age of 3 have some level of gum disease, then the way that that needs to be addressed to get rid of the disease is doing a really thorough dental procedure to evaluate the mouth and see how significant the disease is, and then whatever needs to be done to address that, which there's potential multiple different things depending on the situation. Then from a prevention perspective, if the mouth is healthy, or after a dental procedure when all of the disease has been addressed, then by far the most helpful thing you can do is brushing your dog's teeth, just like in humans, because that can remove the plaque every single day before it can develop into a problem. There's also other oral hygiene things that can be done at home that aren't going to be as effective as brushing, but oftentimes are more practical. And then following up with regular dental procedures on the more preventive side to keep things from progressing. And we can discuss that in a lot more detail in another video.